Hi, I'm Jaya Rajimatai, and today I have Dr. Vishnu Upadhyaya with me. You guys know I love to bring the best characters or best persons for you all because we have a lot of talented people around us, and when it's not like in our time, we used to look at Mahatma Gandhi or Indira Gandhi or Madam Curie to for us as role models. But nowadays, my humble request for the current generation, the growing up generation, look at the people around you. So when I was, I know Dr. Maya, I call her Maya, for almost more than 10 years now because we got an opportunity to work together with Indian Nurses Association of North Texas.
Yes.
So that day, I was so impressed with her because from her, I come to know a lot about nurse practitioner job. So I thought in the beginning he only does family nurse practitioner. Then eventually I come to know about her. She's not holding one degree. There is a lot of degrees. So let us hear from her about her degrees first. Then we will talk to her and see what was her motivation or why she is working or how she become this much hard worker. So thank you, Dr. Maya. So where did you study your nursing?
First of all, I'd like to thank you for giving me this opportunity to talk about my life journey. And thank you for coming this far. I know Euless is very far from Rockwell.
Yes.
Thank you.
But anything for my audience, my goal is that if even one person watch this video and if any changes we can or any motivation we can provide at least one person, I'm so happy.
Yes. Thank you. I like that motivation behind. Matter of fact, Jaya, I should say that's what I have in the back of my mind. I don't have to do great touch majority of people. If I could impact one person, my job, my satisfaction comes from that. So your question was my background.
Yeah.
I'm originally from Nepal. I grew up in India. My mom was a nurse midwife and my dad was in British Army. We are six brother sisters, and my sister is in New Zealand. She's a nurse. She works in a theater. I think I would say my inspiration to join nursing came from her. She guided me to pick the college, which was Rajkumari Amritkar College in India. And she was behind every single action, every single decision I made in my academics. So I thank her for that. After she left to get trained in her career, my mom was my second role model. I lived with her, and I think she was the one who asked me, never ever quit learning. She wanted us to be lifetime learner. She said, even if you have reached your ultimate degree, make sure that you do something else if not in medical field. So we make sure that we know how to decorate, how to cook, how to do community networking besides what I do as my job. So my two inspirations come from my sister and my mom. That's my background, yeah.
Okay. So you studied nursing in India. Then after that, did you work in India?
So just to sum it up, I was working in a cardiac center where we took care of patients after open heart surgeries. I worked there for a year and a half, and then I got picked to go to Bahrain with my classmates. There was a crew that came from Al Khalifa Cardiac Center in Bahrain, and they contacted the school and they picked 10 or 15 nursing professionals from my college, and I was one among them. I went to Bahrain. I worked there for 3.5 years, and I had a lot of networking with my fellow nurses who were preparing to come to USA, and most of them were nurses from India. And again, they were also my role models. They were writing the test to go to US. I said, can I join them? I studied with them. We went to Sri Lanka. We wrote the test, and we came to USA. And I ended up in New York in 1996. Took my NCLEX, and then I moved to Dallas, and I started working in ICU. So that was the birth of my nursing in USA.
Okay, yeah. I'm just interrupting by hearing this. She's clearly telling the importance of networking. That really that word, we all, because when we study, we have a lot of friends. So with it's okay socialization with that through friends, there is a lot of things we can learn from them, and we support each other. And even me also, when we were studying also, we were doing group studies. And plus, of course, the friends has got families. Their sister, brother will be somewhere, they advance their career. So my humble request for you all to never mind, anytime, make good friends and networking. That will help with to use it as career advancement opportunities.
Definitely. I
Okay.
agree with you.
So which year you came to America?
I landed in New York in 1996.
1996. And you are working in the cardiac floor?
No, I had gotten my green card to work in a nursing home in New York. And when I landed in New York, come to find out they did not need any more nurses. So they said, you're on your own.
Oh, okay.
So I didn't have a job. I stayed with a friend. And
So you came through an agency?
so it was a friend who had helped process the paper.
Oh, okay. Oh,
It was not an agency.
oh,
He was a friend, and again through networking, I met him, and very nice, kind guy. Had a nice family, 2 kids. I came in, I stayed with them till I wrote my exam, and after that, I transferred from New York to Dallas because a friend of mine who was working in Bahrain with me was living here, and then she said, if you don't have anything going on there, come to Dallas because it has lots of opportunities.
okay.
So I came to Dallas, and she helped me stayed with her and find a job, and then move into an apartment and get me a good car. I mean, I cannot thank her enough. And again, like you mentioned, networking is very, very much needed. It is very nourishing. They say that you should be an asker. Don't be afraid to ask questions because all they can say no.
Yeah.
But you never know if they're kind and they like to share with their experience.
Yeah.
You can really learn and go very far. My mom says, why do you have to reinvent the wheel when somebody has already done it?
Oh,
Just
okay.
ask them
Okay.
and learn from them. It's not about people who are successful. She also mentioned go after the people who did not make it. So I target both kind of networking, the one who did not make it and the one who really did well, so I can learn my negatives and my positives from their experience.
Yes.
And I'm so thankful in my life that I had big crowd of nice people.
Yeah.
And I thank them. They're my milestones. Every time I take a step forward, I always turn back to thank them because if they were not here, I would not have come this far.
Yeah, that's very important point. Like, you all have to understand there is a lot to say there is a lot of stories to say a failure. Failure has got a lot of stories to tell us how they fail. From there, we can learn a lot because successful people, they move forward, but failure, then after that, if they success, they have a lot of stories, and that is very good for us. We can learn a lot of lessons from us.
Absolutely.
Okay, so you came here, then where you are working? You are working in Parkland?
So I came in and I got my first job in an ER with the help of a friend who I stayed with. And then I stayed there for 2 years. Then I went back to get my nurse practitioner from UT Southwestern. Then I worked in an ER in Mesquite community and went back to work for Parkland. After working for Parkland about 6-7 years, I qualified for a free education. So I started doing my master's in a family nurse practitioner. And then
Okay.
from Parkland, after I finished my family, I worked for other doctors in Mesquite, Sunnyvale, and I learned a lot from them. And then I opened my practice in 2013.
So, who inspired you, or what was inspiration to become a nurse practitioner? Because why I'm asking, in 2017, that was long ago. So, in that time, most of the nurses, either they will do some masters in education or management, leadership. So,
So, Jaya, that's a very good question. Like I said, I had good networking, and I did not know what was nurse practitioner. I had a friend of mine who I worked with. I was in ER and she was in ICU. She called and she mentioned that from next week she won't be coming to work, so don't be looking for her. And I asked her why. She said because she's going to start her NP, Women's Care NP from UT Southwestern. And I asked, what is this about? What is nurse practitioner? So she gave me a little rundown over the phone for 30 minutes. And I said, can I join you? And then she said, it took me a year and a half to apply and get qualified. And I said, but there's no harm in, trying. Can I get the number? She gave me the number of the dean. I called her. She said, come for the interview. I was barely married for like 2-3 months. I took him with me. I had an interview with her and she asked me, why do you want to be a women's care NP? And I was very naive and, to the point I said, my friend is joining and I want to get more education. And I just got married. I would like to know more about women's health. And I got selected the same course that she had to apply for a year and a half. I got in same class because she asked me, can you wait for next year? Because the session will be starting next Monday. And I said, I really like my friend. I want to be with her. If you could squeeze me in. So she made me sign a contract saying we don't have time to do due diligence on you, your transcript, your grades and all that. If you don't make it and if you don't bring good grades and we have to drop the seat for you, you'll have to pay us $25,000. That was the cost of taking the seat. I looked at my husband and said, there's nothing to lose. You're a good student.
okay.
So I signed the contract. I signed that if I don't make it through, I will pay them the money back. And I got in.
Okay. So, after doing the women's health, you work for Parkland?
Yes, I worked Parkland, Vickery Clinic, Daharo, Maple Plaza. I took care of women, pregnant ladies, non-pregnant ladies for 9 years.
Okay. So, does this Parkland has got still this program going on?
This program was very unique. It was offered by UT Southwestern. It was a Women's Health NP certification program. After my batch, they stopped offering it.
Okay. But that was a master's program, isn't it?
No, it was a certificate.
Certificate. Okay. So, then after that certificate, did you go and do your master's?
So I worked for Parkland for 9 years, and according to your career advancement, I qualified for a master's.
Okay.
So if I had gone for my master's in women's health, I didn't have to go through the whole program.
Okay.
But I wanted to navigate, venture out more, because I had already done women's health for 9 years, and I did not want to do my women's health in my master's in women's health.
Okay.
So I picked family practice.
Okay. Good.
Because by then I had kids, I had mother-in-law coming in, staying with me, I had a husband, and I wanted to take care of them.
Okay.
And when they got sick, all I could do was women's health.
Okay.
So I picked family practice track, and I'm glad I did that because along with women, then I was able to take care of children, and old lady and adult as well.
All age group. Okay. So then did you stop there or did you get more degrees?
No, I thought I was done. I started to precept students, and I really enjoyed having young mind and young people around because their knowledge was so fresh. They knew everything. It felt like that I was teaching them, and I would give them the assignment. Okay, so what do you think is going on? What is the JNC guidelines and all that? And I learned all those good things. So staying around with those young students inspired me to go back to school. Because in the end of the day, when we are wrapping up, I would say, what are you going to do? She said, oh, she has an assignment. She has a soap note. She has a blackboard. and all I had to do was go home and take care of
Nothing.
the kids, watch TV, and go to sleep. And I said, no, I need to put a meaning to it. So when I come next day, I can also tell them I did a soap note or I had a blackboard and advanced thing. So just to stay with the group and just to feel like I'm a lifetime student, I just did it for fun.
Okay. So approximate how many students you precepted?
Oh, I really don't know. I have pull-out boxes with thank you card. I really don't know. I think I lost count.
Okay.
I've been precepting since 2000
Okay.
or longer.
Yeah.
Started as an
I,
RN and then as an NP.
okay. I think you got some award for the best preceptor, isn't it?
Right, right.
Yeah.
Yes, yes. I got one. I got twice from TNP, and then I got NP of the year from NTNP. So,
Okay. Yeah, that's good to know that, I understand fully, like, when we get education, we need to share and help others. So through, and you are doing you are precepting students, and they gave you inspiration to advance your degree. And then did you stop with the family practice, or did you do more degrees?
um, so precepting student, I also wanted to add, it's having extra set of eyes when you're taking care of the patients. So you see the patients, you have them see the patients, and you will be amazed at things they find out for you.
Okay.
So to me, when I go out and talk to my friends telling, let the student in, and they say that it's kind of hassle, it slows them down, extra set of hands may mess up. And then I said, turn it around and look it the other way, because extra set of eyes, extra set of hands are a lot of help and can keep you from getting into trouble. And every time it was right. So your question was, did I stop? COVID hit in 2019. I was doing my functional medicine because I highly believe in healing body with food and environment. COVID hit, and most of my patients started to feel sad and depressed, and I did not know. I couldn't find a psych provider for them because they were either shut down or their appointments were too out. And my practice was getting busier with these patients coming back over and over again. Their labs are good, the imaging is fine. I mean, I can't find anything physically wrong, but something was going on mentally. So I thought of doing a mental health NP program. So I joined that, and I'm glad I did that, because with that I was able to provide a holistic where I could, draw the mental wellness and then physical wellness and then add on with the spirituality in it. So it really made me feel that I was able to provide a holistic care.
Okay. So now you are an NP for women's health. You see the patients, women's health, then family practice, then psychiatry. And you got your DNB too.
Yeah, DNP, I got it after my psych. Again, I had students and I just didn't know what else to do. There was no other credentials to add on, and I looked around and it was mentioned that this is your terminal degree. And my friends, again, they were going in and they called, I called, and they said, let's do it together. So we did it together, and I'm glad, because there was a time when I was driving home and I called them saying, I don't think I can do this because it's so hard for me to run the practice, take care of the kids, and take care of these assignments. And they mentioned, we are here for you.
Okay.
So through their
Encourage.
inspiration and encouragement, I was able to get that through.
Okay. So Dr. Maya well explained her about her career advancement. So now currently she is a business lady too. So can we hear when did you start your own practice and where you are now?
So I never wanted to open a practice. I had 3 little kids. I had my NP degree. I just wanted to work Monday through Friday, come home, take care of them. My last clinicals with my supervising MD, who supervised me for almost 8-9 years after I opened the practice, I went in and he took me out to eat on the last day with my husband and my kids. They were in one corner and I was sitting with them. After the conversation, he said, I really admire the way you worked. I finished my 250 hours with him. I signed up with 120. I really liked him and I thought I was really learning with him. So I signed the other 250 and he changed my life around. The way I ate, the way I thought, the way I took care of my family. He became my primary care up until now, and he's the primary care for all my 3 kids and my husband. He handed over the key to me. He had 2 practices. He said, you run one and I run one.
Okay.
I looked at the key and I said, no, I don't think I'm made to run a practice. I don't have any experience. I can work with you shoulder to shoulder, but I won't be able to run your one practice while you are in the other practice. So I declined the offer. 2013, we were sitting, it was New Year. Everything was over. We were sitting and basking the sun, me and my husband. And I had mentioned, I really wish I had my own practice so I don't have to work on weekends. I don't have to come home so late. And I should be able to, pick my own staffing, because sometimes when you go to work for others, you have to work with their environment, with their circumstances, with their staffing. And sometimes they don't go with your mission and vision. And then he's a CPA and he said, if you want that, I can make that happen for you. So that's where the birth of me becoming an entrepreneur took place, January of 2012. It took me 1 year. I was working as a oncology hospitalist for Parkland, Genonc. It took me 1 year to get the drawing of the place, the equipments, the accessories, protocols. While I was working for Parkland, my husband put that thing together. And January of 2013, we did the launching, and I invited most of my Parkland Genonc staff who came in to celebrate. So
Okay. So then, how many clinics you have now?
So I started with one in Mesquite. I used to live in Sunnyvale, so we found a place which was in the middle of my house and school. The plan was my husband would pick them up and I would drop them. So I didn't want to go too far. And my kids really enjoyed eating Sissy's pizza. You give them any kind of pizza they would not like, but they really like Sissy's pizza. So I would drop by, pick the pizza, and then come home. And when I was doing that circle, I saw a warehouse open. I peeked through the window pane and I thought, this is all open. I think I can really make a clinic out of here. We negotiated the deal. We got 3 months for free. We put the walls. I designed it. We put the walls. And a very good friend of mine put it together for me. He even injured his finger the day he was starting the roofing and putting all those steel wires and all that. And then he mentioned, this is my sacrifice. This clinic is really going to do good and you're going to be a good provider. And I think, once again, with networking and good people's blessing, I grew from Mesquite to Garland. We started with 0 to 8,000. And from there, we moved to Garland. And then from Garland, I moved to Euless.
Okay. So now this is the only one clinic you are running?
No, not really. So in the process of moving and growing, very important, I wanted to tell you all, don't get too busy and ignore your self-care, because that's what I did. I took care of my family, I took care of the community, I took care of my children, and of course my patients, but I forgot to take care of myself. So 2020, the health crisis happened, and I had to stop everything at halt. So I had to sell my Mesquite clinic, Garland clinic, and take off for 6 months. And then I went to Nepal. I rested. I regrouped my thoughts and prioritized what was more important. And keeping the self-care was very important for me. So I targeted that, and I slowly opened the clinic back in Garland. Right from the beginning, the mission and vision of the clinic was to provide care with compassion. We were not volume-based, we were value-based clinic. I didn't care if I saw 3 patients or 30 patients. I made sure that every patient had an undivided attention. And with that, you start with 0, and then you have 3, and then 5, and before you know it's 15 to 20. So I had to stop because of the health. Then I reopened, and this time I had to make sure that I don't go beyond 10
Okay.
or 12
Okay.
a day.
Yeah. So you see, and currently this is the clinic you are working, and you see the patients from all age.
All age, 4
Uh,
month and up. I
for
don't
month
do
and
4 month and less because we don't do a heel break,
okay.
those genetic testing and all that, but 4 month and up.
4 month and up, and you see the family any medical issues, then the psychiatric patients and the women's health.
Yes.
Okay. And you have all other facilities like a lab, everything here.
Yes.
Okay. And you are the only one provider here.
So we added, this is a women's health practice which I took over, and majority of my patients were normal, but there were a few that needed complex care, and I was sending them out to my other OBGYN friends. A very good friend of mine approached, and we got her into the system. Now she takes care of all GYN issues that require advanced care in terms of doing colposcopies, biopsies, taking care of skin lesions, any issue that's related to GYN that's out of scope of a nurse practitioner, including surgeries. She does laparoscopic robotic surgeries, taking care of cysts and abnormal cycles and a lot of women issue. So I take care of women with less complex, normal well women exams, STDs, regular checkups, and she takes care of all those that require complex advanced care.
So at present you see these three categories of patients. So you have the supervisory physician, is you have three. Okay.
So in Texas, we need to have women's health. We need to have a MD or DO who is comfortable for for me taking care of this. I do not need to have a psych.
Okay.
I do not need to have a OBGYN. As long as I follow the scope of practice, and then before we sign the contract, you have to sign the agreement with them, collaborating agreement. Do's and don'ts. I don't want you to prescribe this. I don't want you to do this. I don't want you to do this. So those cases we refer out, or those cases we don't take. So like I don't do any triplicate medications. I don't do ADD, ADHD. I don't do schizophrenia, psychosis, because those are don'ts in my practice. The rest I am able to.
Oh, okay.
I've kept the practice very simple, which as a nurse practitioner I feel very comfortable.
Okay.
And the moment I feel like I'm not comfortable, I seamlessly transfer their care out.
Okay. And you see the patient with all the health insurance. Okay.
We do Medicaid, Medicare, all the private insurances, and self-pay as well.
Okay. So and your practice is running good.
By the grace of God, I'm blessed.
We heard about your career advancement and about your business, and I know that you do a lot of community work for here and back home too. So can you talk little about what all things you are doing?
So my mom and dad are from Nepal. My dad was in British Army, so he chose India as the focal point for us to grow and go for education. And it was very close to Nepal, so we could go
Back and
travel
forth.
and know the culture and keep the roots intact and have a better education.
Okay.
In that country, we didn't have anyone.
In Nepal?
In India.
In India. Oh, no families,
No
but
family,
only the
just-
education. Yeah, I used to have a lot of friends with me in the
Yeah.
nursing school from Nepal. Yeah, Darjeeling.
Yeah.
Okay.
My mom didn't speak good English. She didn't even speak good Nepali, but good Hindi.
Hindi. Yeah.
So she would mix her Hindi with Nepali. And she got into this job that she worked with doctors. A lot of people helped her raise the family, 6 kids. There was a time when my parents had problem buying our groceries and our stationaries. Those doctors would come and say, the only requirement we want from your kids is to bring the good grades. We will take care of their stationery for the whole year.
Oh, okay.
So growing up in a foreign land, my mom and dad had a lot of help that helped us with educational aspect of our career. We didn't have to worry about books, shoes, clothes, dresses. We had one of the best. And I remember in return, all we had to do was bring the report card and go to
Good.
the house and show them the report card. And then she said, "Oh, you got an A, you got a B. Why did you get a B?" You know, she would pay attention, and then she would sign up for the whole year of giving,
Groceries.
not the grocery, academics,
Okay.
top of the line books, compass, everything. I cannot forget that. If it wasn't for that person, it would have been very hard for my parents to give us what we wanted. They mentioned that we don't have deep bank balances, but we all want you all to have very deep roots in educational area. So go as far as you want to, whatever you want. That's the stationery place where you go in and register and buy it. The doctor had already called and talked to the stationery guy. If those children come, give them anything they want. So we never had any problem academically obtaining our supplies, our shoes, our clothes. And growing up, I thought, if I become something in my life, I will always make sure that I share it with others. Because when you share with others, it just multiplies. And the satisfaction that you get is beyond comprehension. But we do Monday through Friday, pay for service, you have insurance, you have money, I do this for you, you do this for me. It doesn't give you that much of pride or satisfaction. But when you see random people on the streets or off their doorsteps, not able to come to the clinic, you take your mobile bus, you take care of them, or you supply them stuff that they are lacking. It could be blanket, could be clothes or shoes, or it's beyond my explanation. I've done numerous health fairs, and the best part that I like was, or is, when you're done, you tell them, you prescribe them, they come and bless you, you know.
Yeah.
So you just feel like electricity, you know, like the blessing. I don't have my parents around me, but I know they're up there looking at me and saying, keep up the good work.
Okay.
Somebody had done it for you, you do it for others.
Yeah.
So that's the reason I do a lot of community service, because it's a passion for me.
Okay. Yeah. So you do health fair, then you help others, then you do that for the Nepali communities and Indian communities and whoever here.
Also. So I'm a member of Lions Club. Right now, I'm a current president of Dallas Health Lions Club. We have health members, doctors, nurse practitioners, nurses, MAs. They come in to volunteer, and we are just targeting and providing health care. That is in terms of either hands-on services or prescriptions, or just giving the educational awareness on mental health, COVID, cervical cancer, breast cancer. The department is coordinating the care with UT Southwestern. We have a mobile bus that goes out once every other month, if not every month, and we offer free pap smears, free mammogram through the mobile bus. And now we are going to be adding free prostate cancer screening and colon cancer screening. So again, networking, helping people. And then we have a bus, it's called Mobile Medical Care Unit through Lions Club, Mobile Medical Care Unit Foundation. All of us put together some money and we bought this bus from New Jersey. Right now it's getting tuned up and we will be bringing it out. Wherever there is a demand in the community, we get a phone call and we just go help them. It could be a church, it could be a gurdwara, it could be a picnic place. We just go wherever there is a call and we take care of the people. And I'm so thankful for my team of doctors who don't mind doing joint injections or looking at the ortho issues or cardiac issues and taking care of them right then and there. I still remember an issue. It was a cardiology workshop. The cardiologist had come in with his team where he was offering Doppler, echo, EKG. And during the process, he found a heart problem.
Heart
I don't know
problem.
exactly what it was. His blood pressure was high. He prescribed the prescription and he asked the patient to go see them. I also have a few free clinics that we are working together. 2 years later, we were doing a cardiac health fair again with the same doctor. The same patient who had come in came to volunteer and he mentioned, "Thank you for saving my life. Had I not gotten it done during that health fair, who knows what would have happened to me." So you take care of one soul. That's
Okay.
with the help of other people.
Okay. So you see some patients who don't have any health insurance too?
So most of these people we go out to take care of them don't have any insurances.
Insurance.
So whatever we could take care of right then and there, we do. As a nurse practitioner, I cannot prescribe, but I do take doctors who are willing and who are available to see if they could write the prescription. If not, we are in connection with some free clinics. We refer them there.
Oh, okay.
And they have clinic on Tuesdays and Saturdays, including psych clinic. So they get taken care of along with their blood work, doctor's exam, prescription. They just get it for free. So I'm just connecting dot.
Okay. So now I'm sure you all know I brought you the one of the best goal-oriented, motivated, and community helper to you all. So, like when you look at, there is nothing. What else to say? Education. She's in the highest level of education. Then, if you on her practice, yes, she's a business. He's she's running her own business. Plus, she did not stop over there. Who else can talk openly about the background? We all have some background. Some of us had some hard childhood or better childhood, but when we are in a good position, I'm not telling all of us, but most of us will forget about our background. So here, Dr. Maya, she never forgot the way she came through, and now she is helping a lot of needed people in America and in India and in Nepal. So I hope this video inspired you all a lot. And Dr. Maya, thank you. Thank you for giving me this opportunity.
Thank
And
you.
all the best. And God bless you more and more.
Thank you.
Thank you.
Thank you.
Do we need to? So you do a lot of community work here in America. So what about in Nepal, or do you do anything in Nepal or in India?
Yes. I have not done anything in India, but March or April of this year, we are planning to take a mission trip to Philippines with the Global Helping Hand. And in 26, we will be taking a mission trip to Nepal. 26, 27. March of coming 26, I'm planning to take a medical mission to Nepal, where we are going to take care of 5 villages that have people with many health issues that they're not even aware of. If any one of you are interested to join us on the mission trip, ticket will be yours, stay will be yours. It's 7 days. The health fair is going to be only for 2 days. Mission trip will be only for 2 days, but you get to stay and see the country for remaining 7 days. If you're interested, please call me. I really wanted to thank Jaya for coming and doing this on Monday evening at 7 p.m. I wanted to tell what kept me inspired and kept me going were a few words from my mom. And I remember in Hindi it's called Ruk Jana Nahi, the meaning of which is don't stop, just keep going. And the other one that I learned from my father was never take no for an answer. Always look for it to find out if there is somewhere out there who could help you out. Keep asking and be a lifelong student. With that, I thank you once again. Thank you.
Thank you.